Hello everyone, welcome to Thrive with Dr. Varsha. In today's video, we will see truth of being clinical pharmacist India. We will see expectations and reality. If you are just curious about what being clinical pharmacist is, what are the expectations, what are the realities, or if you want to pursue career as a clinical pharmacist, then this video is just for you. Now the expectation and reality can vary from place to place, that is from where you have received the education and from every institute and every hospital where you have practiced. Now I have gathered some of the expectation and reality based on my personal experience. So expectation 1, that is the work is routine. That means you have to perform daily tasks in a same way and in a same pattern. So everything will be same, nothing will be different. But that's not the reality. The reality is each and every day will bring up new challenges. That is, you may encounter serious side effects, adverse effect. You need to monitor every day each and every patient therapy, but at the same time you may have to modify the patient therapy because of some adverse effect, side effect, or there is no availability of any drug, then you have to replace that drug. So for that, so when all of the healthcare professionals are together to decide on therapy, so during that time your expert opinion will be needed, as each and every patient is different. Even if you see some of the cases and diseases which are common, but at the same time every patient is different, they may come up with different kinds of reactions, adverse effects. So accordingly you have to prepare a medication chart. You will have to contribute in deciding those regimens. So the second expectation is, we as a PharmD, we have heard this expectation a lot and it's very common. That is, we as a PharmD have a right to write and prescription, where the reality is we don't have that right in India yet. So the third expectation is that clinical pharmacists work during standard business hours, where the reality is clinical pharmacists may have to work in morning shift, afternoon shift and evening shift, and also during their holidays and even on weekends. And one thing, that is the phone should always stay on, because you are working in a healthcare area, so any emergency condition may arrive. Expectation 4, that is clinical pharmacist has to work independently. The reality is they have to collaborate with physician, nurses and other healthcare professionals in order to increase efficacy and safety of therapy and to reduce errors that will cause patient harm, and all these things will lead to provide and better patient outcome. Fifth expectation, that is if there is a need in therapy modification, then clinical pharmacist can modify that treatment regimen on its own, where the reality is they cannot modify that treatment on their own because that treatment has been prescribed by a physician. So they have to contact the physician who have prescribed those medications. So there will be a discussion in between clinical pharmacist, why that decision has been made, on basis of what, why they have to modify that treatment. They will be explaining that to the prescribing physician, and then the physician who have prescribed the medication, they both will have discussion and one common ground will come out of it. When the both teams are agree on one common ground, at that time those decisions will be taken on for the better patient's outcome. So in today's video we discuss some few of the common expectations that we heard on regular basis during our internship as well as in our whole career, and we have also seen the reality of all those expectations. This job role is highly demanding, but at the same time it is all worth it. Play a vital role in patients' healthcare and see them getting healthy and happy, standing on their own feet and living their life to their fullest. That's the most beautiful thing. I have also made a video regarding how a clinical pharmacologist day looks like in an hospital, what are their responsibilities in hospital. So if you want to know more about that, then you can check out that video. I will mention the link below in the description box. And if you find this video insightful, please like, share and subscribe. Thank you. Bye bye.